What does diabetes really do to the body? Chances are you've heard the basics. It's all about blood sugar, right? Well, that's only scratching the surface. Today, we're going deeper. In this video, we're going to uncover 7 little-known myths about diabetes that you've probably never considered before, and how these myths could be standing between you and a healthier, more empowered life. Stick around because by the end of this video, you'll have a fresh perspective on diabetes and myth number 7. It's the one nobody talks about, and it could change the way you think about your body and your future forever. Before we start, be sure to subscribe for more tips, recipes, and advice to help you on your journey to better diabetes management. And if you want to knock out type 2 with a simple at-home morning routine, be sure to click the link in the description. Alright, let's jump into the first myth. Myth 1. Diabetes only affects blood sugar levels. This is a big one. Most people think diabetes is just about keeping blood sugar in check, but the reality is, diabetes is far more complicated. Yes, blood sugar levels are critical, but they're just one piece of a much larger puzzle. Let's take a closer look at what diabetes really does to the body. When blood sugar remains high over time, it doesn't just affect your energy levels. It starts to damage your blood vessels. And here's why that's so important. Your blood vessels are like the highways of your body. They carry essential nutrients and oxygen to all of your organs. When those highways get damaged, the organs that depend on them suffer too. This means diabetes can cause damage to your heart, kidneys, eyes, and even your nerves. But what's even more startling is how early this damage begins. You may not feel it at first, but the effects are already taking place behind the scenes. High blood sugar leads to inflammation inside the blood vessels, which narrows them and makes it harder for blood to flow properly. Over time, this can lead to major complications like heart disease, stroke, kidney failure, and even blindness. So, while managing your blood sugar is important, don't make the mistake of thinking that's the only thing diabetes affects. It's like a domino effect inside your body. One thing triggers another, and before you know it, you're dealing with a whole range of health issues that seem unrelated, but they all trace back to one source: diabetes. Myth 2. Only high blood sugar is dangerous. Here's where things get even more complicated. Most people are so focused on keeping their blood sugar down that they forget low blood sugar, known as hypoglycemia, can be just as dangerous, if not more, in certain situations. Let me explain. Your body needs a steady supply of glucose to function properly. And while you definitely don't want it to be too high, you also don't want it to be too low. Your brain, for instance, relies on glucose for energy. When your blood sugar drops too low, you start to experience symptoms like shakiness, sweating, confusion, and weakness. But in severe cases, it can lead to seizures, loss of consciousness, or even death. And unlike high blood sugar, which usually takes time to cause damage, low blood sugar can escalate quickly, sometimes in a matter of minutes. This is especially important for people who take insulin or other medications that lower blood sugar. The goal is balance. You want your blood sugar to stay within a safe range, not just avoid spikes. The idea that lower is always better is dangerous because it can lead to hypoglycemia, which is a medical emergency. So, the next time you're thinking about managing your blood sugar, remember that too low can be just as harmful as too high. Myth 3. If you're not overweight, you're safe from type 2 diabetes. Here's a myth that gets a lot of people into trouble: the belief that only overweight or obese people develop type 2 diabetes. While it's true that being overweight is a risk factor, it's far from the only factor at play. In fact, many people who are at a healthy weight or even underweight still develop type 2 diabetes. Why? Because genetics play a significant role. If you have a family history of diabetes, your risk is already higher. Even if you're eating well, exercising, and maintaining a healthy weight, your genetic predisposition could be working against you. Studies have shown that up to 15% of people with type 2 diabetes have a normal body mass index, BMI. This means that focusing solely on weight as a predictor of diabetes is not enough. And let's not forget about another key factor: visceral fat. Even if you appear slim on the outside, you could still have an unhealthy amount of visceral fat, the fat that wraps around your organs and contributes to insulin resistance. This type of fat is particularly dangerous because it doesn't show up in the way belly fat or thigh fat does, but it can be a hidden driver of type 2 diabetes. So, the takeaway here is that weight alone doesn't tell the whole story. If diabetes runs in your family, or if you're experiencing symptoms like frequent thirst, fatigue, or blurred vision, it's worth getting checked out regardless of your size. Myth 4. Diabetes causes immediate symptoms. This myth can be especially dangerous because it makes people think they're in the clear as long as they're not feeling sick. But here's the truth. Diabetes can develop for years without you even noticing. Many people walk around with pre-diabetes or full-blown type 2 diabetes without experiencing any obvious symptoms. That's because the early stages of diabetes are often silent. You might feel perfectly fine while your blood sugar levels are gradually creeping up, causing subtle damage throughout your body. By the time noticeable symptoms like extreme thirst, frequent urination, or unexplained weight loss appear, the condition could already be well established. And this is where the danger lies. You might not feel sick, but that doesn't mean diabetes isn't quietly doing damage to your body. High blood sugar can cause nerve damage, which may start as a tingling sensation in your hands or feet, but can progress to numbness and pain. It can also damage your kidneys and eyes without any immediate warning signs. The bottom line? Don't wait for symptoms to appear before taking action. Regular checkups and blood sugar tests are essential, especially if you have risk factors like family history or being over the age of 45. The earlier you catch it, the better chance you have of managing it effectively. Myth 5. Type 1 and type 2 diabetes are basically the same thing. Here's a myth that causes a lot of confusion. The idea that type 1 and type 2 diabetes are just two versions of the same disease. While they both involve insulin and blood sugar, the way they affect the body is fundamentally different. Type 1 diabetes is an autoimmune condition. This means that the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. Without insulin, the body can't regulate blood sugar at all, which means people with type 1 diabetes need to take insulin every day to survive. Type 2 diabetes, on the other hand, usually starts with insulin resistance. The body still produces insulin, but it doesn't use it effectively. Over time, the pancreas may stop producing enough insulin to keep up with the body's needs, and that's when blood sugar levels start to rise. While lifestyle factors like diet and exercise can help manage type 2 diabetes, they don't have the same impact on type 1. This distinction is crucial because it affects the way each type of diabetes is treated. People with type 1 diabetes will always need insulin, while people with type 2 diabetes may be able to manage their condition with lifestyle changes or oral medications. Myth 6. Diabetes only affects older adults. You might have heard people say, "I'm too young to worry about diabetes," but that's far from the truth. Over the past few decades, we've seen a shocking rise in the number of young people, including children and teenagers, being diagnosed with type 2 diabetes. This is largely due to rising obesity rates and increasingly sedentary lifestyles. The modern diet, packed with processed foods and sugary drinks, has only fueled this epidemic. What's even more concerning is that when young people develop type 2 diabetes, they tend to experience complications much earlier than older adults. Things like heart disease, kidney failure, and vision problems can show up years earlier in people who are diagnosed in their teens or 20s. This makes it all the more important to recognize that diabetes is not just an older person's disease. Parents, teachers, and health professionals need to be more aware of the signs of diabetes in young people, such as fatigue, frequent urination, and sudden changes in weight. Early detection and lifestyle changes can make a huge difference in preventing long-term damage. Myth 7. Once you're diagnosed with diabetes, the damage is done and can't be reversed. This is the myth that leaves many people feeling hopeless after a diagnosis. It's easy to believe that once you've been diagnosed with diabetes, you're stuck with it forever, and any damage that's been done can't be undone. But here's the good news. While diabetes is a chronic condition, it doesn't have to be a life sentence of worsening health. In fact, there's a growing body of evidence showing that type 2 diabetes can be managed, and in some cases, even reversed through lifestyle changes. Studies have shown that with a combination of healthy eating, regular exercise, and sometimes medical intervention, people can reduce their blood sugar levels to the point where they no longer meet the criteria for diabetes. This doesn't mean you're cured, but it does mean that the progression of the disease can be halted or even reversed. And when you take control of your health in this way, the damage that diabetes has done to your body, whether it's your blood vessels, nerves, or organs, can also start to heal. This is why it's so important not to give up after a diagnosis. Every step you take toward better health is a step toward reversing the damage that diabetes can cause. Yeah, what if you could significantly lower your blood sugar levels in just 30 days with a few simple changes? In this next video, discover the step-by-step plan that could transform your health. Plus, we reveal a surprising tip at the end that might be the game changer you've been waiting for. If you found this video helpful, please be sure to subscribe for more tips and tricks on how to manage your diabetes effectively.